Okay. Good evening, everyone. So this is Dr. Rohini. Welcoming you all for this session on neuroanatomy. So we are going to start with the arterial supply of the spinal cord today. So before this, we have already completed the topic on meninges. This was our first topic when we started with the neuroanatomy. Then we started with the spinal cord 1. In the meninges class, we spoke about the arachnoid dura mater and the pia mater, and we spoke about what are the processes that arise from the dura mater, the various modifications we spoke about, the falx cerebri, tentorium, and the falx cerebelli, and the dural venous sinuses that are held between the different, processes we spoke about. So all that was done in the class meninges. So you can watch this video, which was aired on YouTube 1 or 2 days back. So after that, we started with the spinal cord 1. So we are starting from something that is, at the lower portion. We are going to ascend upwards and then we'll completely go with all the brain, the cerebrum, then different sections in the brain, functional areas, then other, important things. So we'll talk about all that. Today we are going to go with the spinal cord 2, that is arterial supply of the spinal cord. It's not just arterial supply, we are going to discuss the venous drainage as well. So we are going to talk also about Battson's plexus, and we are going to relate it with the vertebral venous plexus. So before that, let me just give you a quick glimpse on the spinal cord. You know that the spinal cord extends, it starts as a continuation from the medulla oblongata, and then it extends up to the level of L2. From the level of L2, you can see that the spinal cord, this portion L2 where it ends is known as conus medullaris. After that, what happens to this? The conus medullaris, beyond this L2, you have tuft of fibers, and that is known as cauda equina. And then later on, cauda equina also ends, and there is only, beyond the level of S1, you will see that there is only one layer that is sticking out like a thin thread, and that is known as phylum terminale. And what is phylum terminale? That is nothing but the pia mater. So this is what happens to the spinal cord. So we'll talk about more on this. The spinal cord is mainly supplied by 3 longitudinal arteries. Okay, there is 3 longitudinal arteries. So out of this 3 longitudinal arteries, you have anterior arteries and posterior. So we'll see how many anterior and how many posterior, exactly where they are present. We'll talk about all this. So as it descends from the brain stem to the conus medullaris, so up to there to its entire length, it will be covered by these longitudinal arteries. All right. So, but you must remember the arterial supply in the cervical region is better with the spinal arteries, but as it comes down, the blood supply is not sufficient. So it needs some extra vessels that can supply the spinal cord. And there are other vessels as well, which help in the supply of the spinal cord. So this is what happens in the spinal cord. So you can see that the vertebral artery is something that comes as a branch. So before this, we'll go to the, yes. So this is the branches of the vertebral artery. But what is vertebral artery? First of all, what is vertebral artery? You know that the subclavian artery is one of the branch from the arch of aorta, right? It has many branches. You can remember this as the VIT, vitamin C and D. Okay, you can remember this as so many branches. 1, 2, 3, 4, 5. So there are 5 branches to the subclavian artery. So we'll talk about more on the subclavian artery and all these branches later. But what does this V represent? That is nothing but the vertebral artery. So that is vertebral artery. So this vertebral artery starts to ascend upwards. Okay, it ascends upwards. It passes through all the foramen transverse area. So you have foramen transverse area in all these cervical vertebral transverse process will have foramen transverse area. It passes through the foramen transverse area and starts to ascend upwards. So once it ascends upwards, it has actually 3 parts. There is a first part, second part, and the third part of the vertebral artery. So now here you can see that the third part is what lies in the suboccipital region. Just before, it ends in the foramen magnum. So the first portion is almost near the scalene muscle. That is the first part. Okay, near the first part, it is near the scalene muscle. And the second part lies near the axis vertebra. And third part of the vertebral artery is related to the atlas. And it is also very important. You must remember that it is very closely associated with the hypoglossal and the C1 nerve. So where is this third part of vertebral artery? It lies in between the hypoglossal nerve and the first cervical nerve. Okay, first cervical nerve and the hypoglossal nerve. In between that, you will be able to find the third part of the vertebral artery. Now, this atlas vertebra has a groove, or a groove that is formed that where it lodges the third part of the vertebral artery. So once it crosses through the atlas, it will enter the foramen magnum. That is where it is related to hypoglossal nerve. That is the 12th cranial nerve, which is in very close proximity with the foramen magnum. And also C1 nerve root also is present very close to it, because these two together, they contribute to the formation of ansa cervicalis. You must have heard of ansa cervicalis. That is nothing but it is formed by hypoglossal nerve and the C1 nerve root, and together they contribute to the loop of ansa cervicalis. Okay, so that is descending loop of ansa cervicalis. So now here you can see that they supply the infrahyoid muscles. Ansa supplies infrahyoid muscles. So now this is where you will be finding the third part of the vertebral artery. Now once you find this third part of vertebral artery, so there is right and left vertebral arteries which, enter the foramen magnum and they fuse together just before the pons. So this area will be the pons area. Okay, this area will be the area where it is very closely related to the posterior aspect of the pons. And here you can see there is a right and left vertebral artery. And before this, what does the vertebral artery give? It gives one important branch that is called posterior inferior cerebellar artery. Posterior inferior cerebellar artery. So this is what I was talking about. I mentioned MAP. So in that, P was posterior inferior cerebellar artery. That is the first branch. So you can see here, this is what is the largest branch that comes from the vertebral artery, which supplies not just the cerebellum, but it also supplies the medulla oblongata, and also it forms choroid plexus of the fourth ventricle. So this is one important question. Which one contributes to the formation of choroid plexus in the fourth ventricle? So this particular artery contributes to the formation of choroid plexus in the fourth ventricle. So now here ependymal cells and choroid plexus together, what do? They produce cerebrospinal fluid. Choroid plexus plus the ependymal cells. They produce cerebrospinal fluid in the fourth ventricle. So now CSF is produced not just in the fourth ventricle. There is CSF produced by those cells in the third ventricle, lateral ventricle as well. But the contribution from fourth ventricle is maximum. And that is done by the plexus is formed because of the branch from vertebral artery, that is posterior inferior cerebellar artery. So posterior inferior cerebellar artery itself, you can have a objective type of question. What all it supplies? You can say it contributes to the choroid plexus and it cerebellum, medulla oblongata. All this could be one option. Okay, so that itself is a nice question actually. So this is what I showed you, that is posterior inferior cerebellar artery. Then you can see that there is one more thing that is descending downwards. What else is descending downwards? You please watch out. That is the anterior spinal artery. You can see this anterior spinal artery is also descending downwards. And on the back side, you'll also see the posterior spinal arteries. Okay, posterior spinal artery. So anterior spinal artery and posterior spinal artery. And then you can also see that the right and left vertebral arteries join together here. There is a right vertebral and left vertebral joining together. And this is known as the basilar artery. Okay, so this is what happens to vertebral artery. So this is what lies at the posterior aspect of the pons. So you will see the basilar artery on the posterior aspect of the pons, and pons is supplied by all these pontine arteries. Okay, so when someone asks you, pontine arteries are the branches of, you can't say vertebral artery, you have to say basilar artery. How is basilar artery formed? It is not a branch, it is a continuation of the vertebral artery by right and left vertebral artery joining together. So nowhere you will see it as a branch. Okay. Many a times basilar artery is given as one of the branch as in an option. But many students have picked it thinking that it is a branch. But it is not a branch. It is just a continuation of the joining of right and left vertebral artery. The branches are all these other things. You can remember it as map. That's why I told you. Remember it as meningeal branches. You remember the anterior spinal artery, automatically you'll remember the posterior as well. Then posterior inferior cerebellar artery. You remember the three important ones. Then there is this medullary arteries, which also supply to the medulla oblongata, will come into picture. Okay. Next one, you can see that the pontine arteries are present, and then what happens to this vertebral artery? Vertebral artery, finally, it ends as posterior cerebral artery. Okay, so that is the last portion of the vertebral artery. So till here, this extent is by the vertebral artery. Then does it supply the other structures like the cerebral hemispheres and the thalamus? Then there are, basal gang. So many other things are there in the brain, the important structures in the brain. Does it supply that? No, it is not supplying those. It is only supplying those extras that we can think of. What are the extras? The meninges are extra. The cerebellum is the different thing. It's a different, completely different lobe. Then medulla oblongata, the brain stem, and the spinal cord. So it mainly supplies the brain stem, cerebellum, meninges, spinal cord. So remember these four things. Okay, I would simply call them as those extras. So these extras are supplied by the vertebral artery. So first part of the vertebral artery is related to scalene, and then the second part is related to second vertebra. The third part is related to the atlas, where it has a groove, and once it crosses the groove and enters the foramen magnum, exactly there it is related to hypoglossal nerve and C1 nerve. It lies right in between those two things. So very important to remember that. Next one. This is how the blood supply of the, okay, this is how you can identify the blood supply. You can see the spinal cord almost occupies 2/3 of the vertebral canal, right? Two-thirds of the vertebral canal is occupied by spinal cord. Rest of the spinal cord is not occupied. Rest of the vertebral canal is not occupied by the spinal cord. And you can see that this is the circle of Willis. But in the previous diagram, I did not want to continue with the circle of Willis because you saw that it contributes to the formation of circle of Willis, but we will discuss this separately in a different class because today is exclusively for the blood supply of the spinal cord. Okay, so we are not going to talk about internal carotid artery and vertebral artery anastomosis at all. So we are only talking about the vertebral artery branches and below whatever it supplies in the spinal cord. So you can see this is the anterior spinal artery. So which runs downwards in this direction. That's why it is called longitudinal. Anterior spinal artery, how many are there? There is only single one. You can see there is a single anterior spinal artery and there is this artery present in the fissure. There is a median fissure in the anterior median fissure. You can see the anterior spinal artery. But you can look at the anterior spinal artery. It is not sufficient. So up to the cervical level, it can efficiently supply along with the two posterior spinal arteries. You can simply call them posterior spinal artery, or you can also call them posterolateral arteries. Why? Because there is one and one, that is two of them are present. There is only one here. So this is how the subclavian artery gives the branch vertebral, how it ascends upwards and how it gets into the foramen magnum, how it lies against the pons, and you can see the pontine branches. All that is beautifully done. And last is posterior cerebral artery. Okay, so this is how it shows. And you can see that up to here, it is fine. Anterior spinal artery and posterior spinal arteries will supply. But later on, the blood supply becomes insufficient. Okay, we'll see what other arteries contribute to the supply of the spinal cord. There is something called radicular arteries. And there is also one more artery, which is very, very important artery, that is known as Adamcubis. Okay, Adamcubis, that is also called great vertebral radicular artery. Okay, and there is this lumbar region, you have lumbar radicular artery. So all these are the extras that contribute to the existing spinal arteries. So this is how they run through the different parts of the spinal cord and they supply. So you can see the spinal arteries, anterior one, and how it supplies through its branches. There are sulcal arteries and it also covers the lateral portion, that is lateral column. It covers the anterior and posterior columns. So now coming to the anterior spinal artery, it is formed from the branches of the vertebral artery like we discussed. It travels in the anterior median fissure and it gives rise to many sulcal arteries. Now we saw these sulcal arteries are the ones which supply the gray matter. Okay. Next, the posterior arteries are two of them. You must remember anterior is only one and posterior there are two of them. And these two posterior spinal arteries, they originate also from the same vertebral artery, or posterior inferior cerebellar artery also can give rise to posterior spinal artery. So this is one variation that you may see in some of the people. So this is a very important point to note down. If it is not arising from vertebral artery, from where does it arrive? It arises arises from the posterior inferior cerebellar artery, which is also a branch from the vertebral artery. So remember MAP map, the P was posterior inferior cerebellar artery. Okay, so cerebellum is not just supplied by vertebral artery. It has got contribution from the internal carotid artery branches as well. So this is one thing that you must remember. So now here it anastomoses with one another in the pia mater. So you remember this posterior spinal artery, what happens to them? They anastomose in the pia mater. So now this is how you can depict it in the picture. You can see there is a central one, that is anterior median longitudinal artery, or simply you call it as anterior spinal artery. So this is where it is and how it supplies the gray matter. And you can see there is a central artery. All right. And then you can see the radicular arteries here. The radicular artery also gives lot of, contribution to the white matter. So it passes, radicular artery basically runs along the spinal nerve. Same spinal nerve, the dorsal and the ventral root, whatever directions they take, it runs in the same direction as them. That is radicular artery. So if you want to look for radicular artery, you have to follow the direction of the dorsal and ventral nerve roots. You can see there are two posterolateral longitudinal spinal arteries. There are two of them. There is one here and there is another one here. And it is connected by the posterior radicular artery. And you can see that radicular arteries always supply the white matter. The spinal arteries, they supply the gray matter. So this also supplies the gray matter. So you can see it supplies the gray matter, and radicular arteries are the ones which supply the white matter. Along with the radicular artery, you also get contribution from segmental arteries. So this is one thing. This is one. So this is one type of blood supply. This is another contribution. This is another contribution. So up to cervical level, only these two will manage, the anterior and posterior spinal arteries. But beyond the cervical level, you have the contribution from segmental artery as well as the radicular arteries. So you can say that this particular section is from some area below the cervical region. So, however, now this is exactly what I was trying to say. Below the cervical level, supply from these longitudinal arteries becomes very insufficient. So, there is support or anastomosis that you can see. We saw the anastomosis just now with the segmental medullary arteries and radicular arteries. So, these two contribute equally to the supply of the spinal cord. So now anterior and posterior segmental medullary arteries are, where are they derived from? They are derived from the spinal branches of number of arteries that are present in the vicinity. So before they enter it into the vertebral canal, they pass through intervertebral foramen. Like we saw them, they have to pass through the intervertebral foramen, and only then they can form the anastomosis with the spinal arteries. So you can see this is the segmental artery and how it passes through the intervertebral foramen, and you can see that it also forms anastomosis with the spinal arteries. There are two of them on the back side. There is one here, there is one here. There is a single anterior spinal artery. There are two posterior spinal arteries at the back. And anterior, you remember, this side is broader. The gray matter on this side is broader on the anterior side. Posterior, it is tapering. Okay, the fissure is deeper. Fissure is shallow. Okay, so now here all this anastomosis, all these things happen in the pia mater. So you can see there is posterior radicular artery, there is anterior radicular artery. This is the segmental medullary artery. You can also see left posterior intercostal artery. So there are so many things that is anastomosing with the spinal arteries. So one more thing that you must remember is, now in the lower region, in the lumbar region, so there is one, artery that is very dominant, that is known as Adamcubus. It reinforces the circulation to the inferior two-third of the spinal cord, that is in the lumbar region. So that is also known as the anterior great anterior segmental artery of Adamcubus. So this is the important artery that is present in the lumbar region. So this enforces more blood supply to the lower portion of the spinal cord. And it is found on the left side in majority of the individuals. And some individuals it may be found on the right side as well. So what is this artery and why it is named in such a way? So it is named after the great scientist Albert Adamkiewicz, who was a Russian scientist, and then it is one of the largest anterior segmental medullary artery. So it is given a separate name because it was discovered later on. And where does it arise from? It typically arises from the left side, left posterior intercostal artery. So most of the people, it is arising from the left side, and that is dominant. It branches from the aorta at the level of T9 and L2 levels, and it supplies the lumbar enlargement. So this is one important thing. Lumbar enlargement, which is lying between this T9 and L2. Okay. Sometimes it is T11 and L2 is what is given in some of the books. This is the lumbar enlargement. And this is supplied by this particular artery of Adamkiewicz. And it is also known by so many other names. There is other name called great radicular artery, major anterior segmental medullary artery, or sometimes it is also called artery of the lumbar enlargement. So you can see all these things lined up in this particular diagram, where you can see the vertebral artery forming the basilar artery, and you can see the radicular arteries and spinal arteries. Then there is posterior spinal and the medullary arteries, dorsal root, ventral root, segmental arteries. Everything is in place. This particular picture also shows how the segmental arteries arise from the aorta. And how they supply the spinal cord through their branches. So this one particularly is the artery of Adamkiewicz, and that basically starts from the lumbar enlargement area. So here you can see Other than that, I told you there are radicular arteries, which are basically the ones which follow the same path as the nerve roots. You have dorsal nerve root, you have ventral nerve root. It follows the same path as these nerve roots. And these radicular arteries may also contribute to the spinal cord supply, but not as much as the other segmental arteries. And then coming to the venous drainage. Now, that is about the arterial supply. Now, coming to the venous drainage. Now, venous drainage, there is 3 plus 3. Okay, there are 3 anterior and 3 posterior. There is a one single median one and there are 2 lateral ones on the posterior aspect. This is posterior, this is anterior. So, on the anterior aspect, one central anterior median is present and there are 2 of them which are present at the back. They're called posterior ones. So you can see there is anterior and there are 2 posterior ones. Okay, so now here you can see, that it supplies all these areas, or it has tributaries in all these areas. But there is one thing that is very important, that it forms plexus with many other vessels that are running in this area. So these veins, this is venous drainage and it is by 3 plus 3, and you can see there are 3 anterior and 3 posterior spinal veins, and these veins are nothing but they're valveless. They do not have the valve. So since they don't have any valve, they can also contribute the spread of infection. Since the valveless nature of these veins, it can contribute to the spread of infection. How do you think it can contribute? Because there is something called Baxton's plexus. So now you can see there is this plexus that you can see around this. These are all the internal vertebral venous plexus that is present especially in the epidural space. So this one communicates with other veins. It communicates with other veins in the vicinity. Now these are all happening in the which area? This is all happening in the pelvic lumbar area. Here there are so many things that is, there are so many veins that drain from the pelvis, urinary bladder, prostate. So all these veins also carry, their contents, and they communicate with the internal vertebral venous plexus. And what is this plexus that forms between them? It is known as Baxton's plexus. And since there is a communication between these two, there are high chances that if there is a carcinoma of the bladder or the prostate, it can be easily carried to the vertebral venous plexus. And these vertebral venous plexus, they also have communications with the intercostal veins. Since intercostal veins also communicate with the mammary gland, it can also contribute to the carcinoma of the mammary gland. Okay, so there is a connection between all these things through the plexus. So since the valveless nature of these veins can cause so much of, problem, it's very important to make sure that your, the carcinoma is under check, because there is a lot of communication that happens through the venous plexus in the vertebral region. So this is Batson's venous plexus. It is also known as Batson's veins, and he was Vivian Batson, And he's the one who coined this. And network of valveless veins is what connects so many things, that connects the deep pelvic veins and the thoracic veins. That is what he coined. And then he said that the inferior end of the urinary bladder, breast, prostate, all this, they all drain into internal vertebral venous plexus. So you remember, what is a plexus that connects them is known as bats and venous plexus. This is a very important information one should remember. Okay. So now here, because of the nature of having no valve, there is a very high chance that the carcinoma could spread from one region to another region. So this can also provide a route to breast cancer metastasis to the vertebrae. So from there to here, from here to there. So it can also transfer to the skull, pelvic bones, and also it could enter the CNS. So it is very important. The mammary gland, when you study, you also put a light on this plexus that is called Batson's plexus, and see how it spreads. Now, see what are the communications, what are the tributaries and communications. If you know, it is very easy. So there is posterior intercostal veins and posterior intercostal veins where this is near the mammary gland. Okay, this is where it has communication with intercostal vessels in the thorax. From the thorax, it passes through azygous, hemiazygous system of veins. Along, it is, you know that azygous, they are present very close to the proximity of the vertebral bodies. And here they have communication with the plexus that forms with the internal vertebral veins. That is Batson's vertebral venous plexus. And then here they have surrounding structures, that is the urinary bladder, prostate, and all these other structures in the pelvis region, they all drain into similar venous plexus. So the metastasis of the cells can happen from any of these regions. So that is from thorax to pelvis and also to the lumbar regions. So this is something you must remember. So now here, that is what we wanted to, highlight. And this is something that I want to, give you a little information. Today we spoke about the spinal cord number 2 part. That is basically the blood supply. Blood supply in detail we heard. And the blood supply of the brain, that is circle of Willis, will be a separate session. So we spoke mainly on the vertebral artery and its branches. And what are the branches that supply the spinal cord? And what is the venous drainage of the spinal cord is what we spoke about. So you have similar classes like this. Tomorrow you have spinal cord 3, where we are going to talk more about the spinal cord injuries. So spinal cord injuries, there are various syndromes. There is a posterior cord syndrome, anterior cord syndrome, and infarction of the spinal cord. All that we are going to study in the spinal cord number 3. Okay, so watch out for this time. That is at 10 o'clock on YouTube. This is spinal cord 3 tomorrow. And then you also have every day, almost every day, 7 p.m. anatomy topic. That will be a gross anatomy topic. And then you also have special classes at 8 a.m. And then there are some classes that is coming soon. And that is on 19th, 20th, 26th, 27th, and 29th of June. And then you have 12 plus 2 offer. That is altogether 14 months of subscription, that too with the 10% discount. So you can avail this by using the code ROHINI. This is a promo code or referral code. Similarly, you also have 3+1. Okay, that 1 month is free subscription, which will be added to your 3-month subscription within 30 days. Next, you have this so many topics, like I mentioned, spinal cord 1, which got over yesterday, Spinal cord 2, which we completed now. This is the spinal cord blood supply. So part 3 will be injuries. Similarly, we completed meninges. You can go back, look up the YouTube videos for this. Then we have so many quiz up things, and we had some nice mnemonic devices and study read formula that we discussed in the last weekend. That is on I think it was Friday, Saturday is what we discussed. Please go back and see those YouTube videos. It is just few minutes and it will give you a lot of information on how you should study or what should be your trick or mnemonics to keep the things retained in your brains. And then you also have these special classes like I mentioned, and these special classes need a special app, that is learners app. You can download this with the Google Store or App Store, and then you can go look for NEET PG section. Look at all these educators, follow them, subscribe to their classes. My name is ROHAQUA. This is the username. This is ROH and ROHINIYN is my name. So my topic is, or my subject is anatomy. Please like and follow. All your likes and follows are really going to be very much appreciated, and it is definitely going to motivate us to do better. And then you also have all these things lined up, like you have a parotid gland, cavernous sinus, that was done, upper limb recall 1, 2, all this was done. And please go fetch your PDF notes. So all these PDF notes you can get in case you miss the classes. Don't forget to watch these classes every single morning in the morning hours on special classes at 8 a.m. So NEET PG seasons batch are also starting from June 16th. And you have high yield topic revision classes, test discussions, and many things. And you also have free INICET grant test, which was held just today, this morning at 8 a.m. If you missed, wait for the next one. And you have 36-month subscription where the prices are slashed down and made to just 58,500. And this is for 36 months subscription. That is more than 2 years of subscription. So you have unlimited access to Unacademy and Prep Ladder. So you have just 500 first students, first come, first serve basis will get this offer. The target next 2022 evening classes are starting from 16th of June. You have lot of sessions including doubt clearing, in-depth subject-wise preparation, PDF notes are available, and you also have recorded session. All that is available with these top educators. And you also have this EPACT framework, MBBS, professional year batch 1, like that you have second year topics, batch 2 and batch 3. You have the phase 1, phase 2, phase 3. It is divided into where the phase 1 will cover all conceptual coverage. The topics are covered. The second one will have revision. The third one will have all the tests covered. Likewise, second year and third year topics are also equally covered. Next, you have this NEET PG subscription, that PG plus iconic subscription, where 36 months you will get it for a EMI of 1,250, which is no cost EMI. You have to have at least 6 months of subscription to avail for the same. So use this code ROHINI and you can get 10% discount on your subscription. So you have iconic subscription, this is new, and access to both the best learning platforms like the Unacademy as well as prep ladder is what you're going to get. You will not just get the live classes access, but also video classes, lectures, and also the Q bank, that is question bank series, the test, quiz, revision, everything is at your disposal. But you need to use the promo code ROHINI to avail all the 10% discount. So don't forget this. This is my name itself, ROHINI, and my name is Rohini. Fine. So with more than 10 years of experience in teaching the subjects like anatomy, physiology, and microbiology, I would urge you to take plus classes and subscriptions for iconic subscriptions like this, and get good guidance so that you can reach your goal without any hurdles in between. And then you also have this new batches starting every 2-3 months. So please look out for this information on www.unacademy. Don't forget to follow and like all the videos. Your encouragement and motivation is what we look for to do even much better. All these are free classes. So if you are looking for 100% curriculum, please go for the subscription. Thank you. Me here, Dr.